diseases which are having much similar signs and symptoms and even the lesions. Okay, those are about the rinderpest and the Pesticides ruminant PPR in short. Okay, just a minute. Someone is waiting, I think. So first one I'm taking up about this disease, rinderpest, commonly known as cattle plague. Last time, of course, in the exam, some question was there. Even means we have not discussed about this disease. So I would like to give little bit brief idea and important parts of this disease. Actually, I mean, this disease has already been eradicated from the globe. Means there is no more occurrence of this disease. But why? This disease is still in the syllabus, and why we need to know about this disease. That is very much important. Okay, that means when the disease is not occurring at all in any part of the world, why we should study, why we should learn about this disease. That is important because there are many things to be learned from this disease. Okay, and something is still, I mean, this hidden, like, I mean, some thing we need to know about this disease because of many, I mean, hidden things. And still, I mean, similar disease of this PPR, Pesticides ruminants, of course, in case of this goat, particularly, sometimes sheep also, like mostly goat, I mean, small ruminants, still it is occurring. So that was having very much similar with this disease in those days when the rinderpest were there. Okay, means it has been already eradicated, but we need to know many things from this disease, right? So the rinderpest was, I mean, in those days, one of the most uh, difficult, the serious type of this disease known as cattle plague, killing all the, I mean, this cattle population whenever it occurs. That's why cattle plague or cattle killer it was known as. And it was very much contagious and highly infectious type of this disease caused by a virus known as morbillivirus, and affecting almost all the cloven hoof animal, causing high mortality, means almost 10% mortality, mostly in bovine population, as well as in case of this small ruminants also, like your sheep and goat. Okay, and the most characteristic features were erosive mouth lesions and hemorrhagic enteritis. So because of this erosive mouth lesions, sometimes maybe it was much confused. Some cases, I mean, were confused with the vesicular diseases, because after the erosion of the vesicles, I mean, in case of this vesicular diseases, so they used to show the, I mean, these erosive lesions, right? But of course, vesicular eruption will not be here in case of this rinderpest. But because of the erosive lesions, it was very much confused. And mostly it affects the cattle and the domestic buffalo, including the water buffalo. And most of the wild and the domestic cloven hoof animal like this zebu, then cattle, sheep and goat, pigs and wild ungulates in contact with the cattle can also infect. So means mostly, of course, cattle population in domestic buffalo, but sometimes some other species of this animal, including your small ruminants, could also be affected in those days, right? And the organism, the causative agent, as I was talking about, it is known as morbillivirus of the family, Paramyxoviridae, and other members of this same family. I mean, there are some more amtis viruses like Pesticides ruminans virus, measles virus as in case of this human, then canine distemper virus in case of canine, then faucet distemper virus as in case of the sea mammals. So this, all these, I mean, these viruses having, I mean, similar, I mean, the antigenically anti-similar type of this virus they are. And the history behind this disease, rinderpest, this is one of the most important part. I mean, because of this disease, so many, I mean, this, what to say, this, to be learn, I mean, this, after this disease, and many institutions were, I mean, established because of this disease. So number one is about the establishment of the first veterinary school in Lyon, France. That was in 1762. That means because of the outbreak of this disease in France and other parts of the world, of course, and the academicians, researchers, scientists, they were all having very difficult time to know about this disease, to learn about this virus. And so they felt the need of establishing an this a veterinary school. So it was established then the first veterinary school in Lyon, France, to study about this virus. I mean, this rinderpest virus, to know about this disease, means what kind of disease, why it is happening like this, to study about this, to learn and to diagnose and to research, do research on this. All right. Then some, I mean, this a great pandemic, African pandemic occurred during 1885, killing almost 80 to 90% population of cattle, and even wild and this bovine, I mean, this ruminants in Africa. And the establishment of, you might have heard about Indian Veterinary Research Institute, which was established in 1889. That was first. Now, of course, it is shifted to this IVRI, I mean, at this Verily. But first institute, it was established at Mukteshwar in Kumaon district, right? I mean, in this, now it is in Uttarakhand, right? So the establishment of this very important, and I mean, this big institute, Indian Veterinary Research Institute, the reason behind the establishment of this was also the disease rinderpest. I mean, to study, to do research on the virus, I mean, morbid virus causing this disease, what we call rinderpest. Then the formation of the World Organization for Animal Health, commonly known as OIE, right, in the year 1924. That was also because of this disease. Then in the year 1992, eradication program known as Global Rinderpest Eradication Program has been adopted. Then, under this, the National Project on Rinderpest Eradication Program, commonly in short NPRE, were launched in the year 1992 and on 1st April in India, right? And after a global eradication campaign, I mean, under this project, under this eradication program, global rinderpest eradication, and then nationally, I mean, in case of India, NPRE. So a campaign was going on to, I mean, find out the occurrence, the presence of this disease in each, I mean, every nook and corner of the different countries. So after that, I mean, this global eradication campaign. So the last confirmed case for this disease, rinderpest, was diagnosed in the year 2001. And after this, India also, I mean, under this project, I mean, this eradication program, that is NPRA. So it was going on. After, I mean, this 5 years, okay. So of this complaint and this campaign and all these things, then India had been finally declared free from this disease in May 2006 by OIE. So far the world is concerned, the global, I mean, it was declared, I mean, free from this disease by OIE General Session in the month, I mean, of May 2011. And on 8 August 2011, the United Nations held a ceremony for declaring the free from this disease eradication, that the disease has been completely eradicated, free from this disease globally, means all part of the, I mean, the whole, I mean, this world. So from this disease being the second disease which has been eradicated from the globe after smallpox. Okay, that was in, I mean, 8 August 2011. So this history behind this disease is very much important, number one. Then now, I mean, these are some photographs about the Rinderpest outbreaks in those days, 18th century in Netherlands. Then this great African pandemic in 1896, killing, I mean, almost, I mean, this 80 to 90% cattle population. So now, second point is that when we have talked about, I mean, the history behind this disease, Rinderpest, the institutions, I mean, like, I mean, this first veterinary college and IVRI, I mean, this, then a formation of this OIE, where, I mean, all on this, after this disease, I mean, because of this disease, right? Then it has been eradicated from the globe and no more occurrence of this disease. But why? We are studying this. The question arises that why still it is in the syllabus and why we need to learn this disease is still and it is kept in the syllabus. So that is the post-eradication phase. That means after eradication also there are some, I mean, these difficulties or like some, I mean, this problem we may come across. Okay, that is the number one point is that, you know, I mean, during the, I mean, this diagnosis and the poor confirmation.
Hi, excuse
Yes.
me, sir. Sir, some students are still
Okay. Okay.
waiting.
Okay. Okay. So now let me continue. So this post eradication phase is nothing but during those, I mean, this diagnosis and the collection of the samples and all this, and those viral samples, I mean, virus stocks and all these things, it has been kept in many of the, I mean, these laboratories. I mean, some of the, I mean, laboratories like maybe as per the record means 40 laboratories worldwide. Okay, over, I mean, this more than 40, almost, I mean, 40 laboratories worldwide, and still it is there. Okay, and this kind of this stock, I mean, the virus, live virus stock is still there. I mean, it has been kept in modern and just 40 laboratories worldwide and all. You know, I mean, about the biological weapons and your and this intentional terrorist act and all these things. Like, if somebody, some group of these insurgents or like some country or some, I mean, this what is it? These people intentionally, if they would like to, I mean, this take out just kind of these samples by giving bribe, maybe, or by managing some way, I mean, this, or intentionally by insurgency, I mean, this mentality or insurgent mentality, like, so accidentally also sometimes. So those viruses can be leaked out from those 40 laboratories which has been have been kept keeping this virus in those laboratories, right? And once if it is leaked out, it has been coming out, maybe intentionally or by this your accidental release or by terrorist act and all these things. Then again, chances is there for the reoccurrence of this disease, right? And one another this factor is that, I mean, you might have heard about the biological weapons. Okay, by using the biological organisms in the form of this war, like by using this as weapons, right? We know we used to talk about biological war or by using biological weapons, you know, these organisms. I mean, you might have heard about the disease anthrax. Of course, we learn this in details later, right? So this way, these virus can be used if they, I mean, accidentally really or by terrorist act and all, if it has been taken out from those laboratories and spread out some country, like for example, I'm just giving the example of India and China. Like, suppose if China want to make a war, I mean, this declare a war to India I mean, by using this, I mean, the biological, this organism, this Rinderpest virus, morbilli virus. Okay, by terrorist act or from those laboratory, then they may send, they may this spread out this virus to India. That means there will be reoccurrence of this disease, and then that is the, I mean, this there will be a chance of reoccurrence of this disease, and it will kill the entire population of cattle here. So war doesn't mean that by using the lethal weapons killing people and or not. Only that is not the only objective of war. That means the nation or the country should face some problem economically or many other ways, like, or if they do like that, suppose India being in this agricultural and this country, I mean, this we depend mostly on agriculture, right? So if we don't have those and this cattle population, and not only for agriculture purpose and for food purpose and all this also, so then we will face automatically, I mean, drastically, I mean, this affected, I mean, this because of that. So that is also another objective of war. So this way, it can be, I mean, this utilized that way also. So these things can be as a potential source of this virus, this Rinderpest virus. So until and unless these stocks which have been kept in those laboratories completely destroy, or and this it has been kept in containment facilities, then chances of reoccurrence is there by intentional accidental release or through your this terrorist act. So that's why, I mean, we need to know, I mean, only this after this history, then the post eradication which may have another reoccurrence of this disease by those and this what to say, this acts or terrorist accidental release or this I mean, then now, I mean, the problem will be, as means you might have heard about this, even this coronavirus also, like the first phase when it occurs, then the second phase now it is going on, like second wave. So there used to be mutation, changing in the genetic transformation of the, I mean, this virus used to be there. The genetic and this conformation and used to be transformed. Then changing in their structure and all this, and then the disease pattern, the sign, symptom, even the pathogenic effect also will be changed. More this, there will be more vulnerable, more difficulties will be there, right? So this way, if there is reoccurrence of this disease, also there may be another more difficulty, more pathogenic form of this virus may come up, and that may kill, I mean, the entire population, same population, and even the differential diagnosis from the disease PPR when it occurs, particularly in the small ruminants like this goat, will another this have this difficulty. So now, of course, there is no occurrence of this disease in the past. So whenever you have this similar type disease, it means you may think of only PPR. I'm talking about the small ruminant like your goat. Okay, but there is reoccurrence, then you should, I mean, go for differential diagnosis from this Rinderpest and this PPR. So that these things, I mean, difficulties means you may come across, and this is we are talking about the post eradication phase. So this is the that is why, I mean, still it is there in the, I mean, the syllabus, and we need to learn about this disease. And the first point was your history behind this disease, the establishment of those big institutions, the first veterinary school, and then your, I mean, this establishment or formation of this OI and all this, and then about this post eradication phase, right? So now, I means I will not take much time on this, because only the characteristic features of this disease I would like to say, because means we need to know something about this disease characteristic feature. Then now, which is going on in the this population of your small ruminant like this goat, about the PPR, I will jump into that. I mean, this after having some this classical feature or the characteristic feature of this disease, right? So economic impact, I mean, these things, as we have already discussed about the economic importance and the impact of a disease, means what kind of this losses used to be there because of the disease occurrence and all this thing. So of course here it is due to the main this mortality, almost 90%, 10% mortality. So direct loss used to be there, and then your course involvement and these things, many other points as I have already discussed, so I will not take time here. Then morbidity, mortality, as I was talking about, means almost 10% mortality maybe, but some differences may be there, means among the population of the animal. We used to talk about one this terminology you might have heard, or I don't know, and that is NAP population of animal. NAP population means those animals which have never been exposed to this disease or any kind of disease. Okay, means very much innocent, not much and this exposed to any kind of this disease. When we are talking about this, means particularly this disease Rinderpest. So those animal population, cattle population which have not been just exposed to this disease Rinderpest, so that is known as NAP population. If it occurs in those populations, then there will be 10% mortality, right? This way, this, if it is already exposed, and survived from that disease, or like that is already exposure is there, so that's why 10% mortality may not be, maybe 70, 80 or 80, 90% maybe there like that. Then animal transmission, these things, means I will not take much time here. This those things I will go for in the this PPR, like, okay, pathogenesis little bit, means I would like to tell about the pathogenesis, means how the disease used to develop and the effects and the system and causes the pathological changes, right? So inhalation is the main route of this entry of this virus. So entry through the inhalation, after getting into the body through inhalation, the virus used to penetrate the epithelium of the upper respiratory tract. Then they will start multiplying in the nearby tonsils and mandibular as well as the pharyngeal lymph nodes, means the surrounding nearby lymph nodes. Okay, the tonsil, mandibular, and the pharyngeal lymph nodes. From there, they used to go into they used to get entry into the lymphatics, from this lymph nodes, and targeting the mononuclear blood, mononuclear means lymphatics. Then from these lymphatics, again, they will go into the circulation through the lymphatics, then to the circulation, and targeting most commonly the mononuclear cells, okay, like lymphocytes, mostly lymphocytic cells. So they are, that's why, having the affinity to affect, to target these lymphoid organs and tissues of the system, most commonly the alimentary tract. Okay, and I don't know, means you might have heard about the, this some organ there in the, this alimentary tract lymphoid organ. Have you heard about the Pear patches in the this alimentary system? That is the lymphoid tissue in the alimentary system. So that is most commonly targeted because it is formed by lymphoid tissue, form of this lymphoid tissue. Okay, so other lymphoid organs and tissues like lymph nodes and other organs like your spleen and all these things, so like, so all these lymphoid organs, then sometimes lungs and epithelial cells on the mucous membrane used to be targeted and they used to be affected. And because of this affinity to target and to affect the lymphoid tissue, they will cause severe destruction of the lymphocytic cells, that what we call lymphocytolysis. And because of that, there will be reduction in the number of total WBC count, means that is leukopenia. So this leukopenia is mainly due to the destruction and the reduction in the number of lymphocytic cells. What means lymphocytolysis, breaking down of the lymphocytic cells, leading to reduction in the number of total count, WBC, right? Then when the virus used to gain entry into the circulation, at that stage, of course, there will be, there will be a viremic phase, and this with fever that used to develop within 2 to 3 days, and the mucosal layer of the this respiratory tract and mostly the alimentary or the digestive tract used to be affected, leading to necrotic and even hemorrhagic changes. This is the pathogenesis of this disease, your Rinderpest, and similarly means it will be there in case of your PPR also, right? Now coming to the clinical signs, the clinical findings means how the affected animals were showing the signs and symptoms in those days and all. Incubation period used to be very from 3 to 15 days, but usually 4 to 5 days. But the animal used to show in 4 different forms, like classical form, per-acute form, subacute, and atypical form. The most important one is the classical form, means in which the most characteristic clinical signs and symptoms, even the lesions, used to be found or observed, right? So here, the clinical signs, the main clinical signs will be high rise of this body temperature, depression, anorexia. Then there will be constipation, which used to be commonly followed by severe hemorrhagic enteritis leading to diarrhea. And there will be serious to mucopurulent type of these discharges from the nostrils as well as from the eyes. That means nasal and ocular discharges, which used to be serious initially, then turn into mucopurulent type from the nostril and this eyes. These secretions will be coming out, and the targeted organs, mostly the alimentary tract starting from the oral mucosa. So there will be necrotic lesion as well as erosive erosions in the oral mucosa, where very typical type of these lesions we used to say, as I'm showing here, see, I mean the erosive lesions in the mouth cavity, the gum and all these things, all the these other parts mucosal layer of the mucosa and the oral mucosa. So they are showing this erosive as well as necrotic lesions. So this type of these lesions, when it is looking like the deposition of this rice bran like this deposits, I mean on the gum and other parts of the oral mucosa, right? So that's why it is known as rice bran like deposits on the this oral mucosa. This is very much typical, and it used to be there in case of this PPR. I'm talking about this in God also, like when PPR, the disease PPR used to be there, and it is due to this Rinderpest also. Because of that, this erosive and the necrotic lesions and all, so it was confused. Differential diagnosis was much important, and in those days from Rinderpest, the disease, this PPR. Then, being this having affinity to affect almost all the lymphoid organs and tissues, so there will be, this enlargement and swelling and the enlargement of all the lymph organs, lymph nodes. Okay, and that usually occurs within 6 to 12 days, and mostly this is due to severe hemorrhagic diarrhea. When we are talking about the diarrhea, all these things, the death of the animals, the mechanism of that, okay, it is mainly due to loss of body fluid, electrolytes, and all. Means because of the diarrhea, okay, the hemorrhagic diarrhea, blood is losing, then body fluid is losing. So because of that, it will to lead, and this lead to hypovolumetric shock, means losing of this body fluid, blood, as well as your this electrolyte imbalance and all these things. So there would lead to a shock condition that is known as hypovolumetric shock. So because of that, the animal used to die. Right? That is a mechanism of that. Why the animal used to die because of this disease. Then these are some more pictures. The animal used to be very much emaciating, and this is the depressed and the exhausted and very much weak, and they used to collapse, and this animal used to be there, right? I'm showing that. Then these are the pictures showing severe and this hemorrhagic diarrhea. Down there on the floor. See, then sticking swelling of the direct feces on the tail and this hind portion of the limb and all this entire region and all. So showing the severe form of this diarrhea. These are all, and then one very typical form when we are talking about the diarrhea, very typical, that is typical form of this diarrhea used to be the direct feces used to be shoot out. Shooting diarrhea we used to term as, if you see here, means the feces and this direct feces is just force out the gum shooting out of the this anus, right? This. So it used to be that type of this diarrhea, and when you see the direct feces falling on the this ground and all, so it will contain this blood also, like mucus as well as this blood, right? So that kind of this typical and this appearance. I mean, this diarrhea physics used to be there, and the nature of the diarrhea also will be of, I mean, this shooting type of this diarrhea. Then these are some more pictures showing those, I mean, the erosive and necrotic lesions of the oral mucosa, and these are what I was talking about. I mean, this rice brown deposits, brown like deposit. Okay, so these are very much typical in case of, I mean, this rinderpest in cattle. And what is waiting outside? So why they are late? And then these are some more pictures showing the conjunctivitis and mucopollutant exudates from the on this eye. I mean, ocular discharges, as I was talking about. Initially, there used to be serous discharges, but later on, mucopollutant type of this discharges it become and this thicker. Then excessive salivation. Because of this sign, this excessive salivation, as in case of this rinderpest, that is due to the erosive and necrotic lesions of the oral mucosa. So the salivation means hanging down from the mouth here also. So that's why little bit confusion with those vesicular diseases. So that's why means in the differential diagnosis of the vesicular diseases, rinderpest also used to be included, right? Then so far the other three forms are acute, subacute, and atypical forms. So when we are talking about the clinical signs and symptoms, so in case of this part acute form, very young animal mostly with very high fever, congested mucous membrane used to be there, but that usually occurs sudden death within 2 to 3 days without showing much clinical sign and symptom. That is as in case of this acute form, and in case of this subacute form, the subacute is means mild form. So that's why mild clinical signs and symptoms with low mortality will be there. And the last one is known as atypical form, which is not typical from this disease. There is not any typical this sign and symptom for this. Maybe there may be irregular fever, there may be mild, or there may be, I mean, this mild diarrhea or no diarrhea also even. But there used to be immunosuppression. Okay, that is mainly due to the affection of the lympho organs and tissues where lymphocytolysis used to be done. Lymphocytes, lymphocytic cells or lymphocytes are known as immune cells, right? So if they are destructed, automatically there will be reduction, I mean, suppression in the immune system. So this kind of this immunosuppression, so if the animal are having this immune suppress or immunosuppression, then automatically they can be affected very easily by secondary invaders, secondary bacterial or other viral agents. Okay, so that's why I mean this immunosuppression may have some more and these infections and this may come up and easily they can be this targeted, right? So these are the other three forms. Then now, I mean, this, I'll just jump to the, these are just photographs showing those and this kind of cases. Then the inflammatory and this condition there in the vaginal, this lining membrane. Then clinical signs as against this swine. I mean, it is not that important. That's why I'm not giving much important here. I mean, swine can also be affected, showing some mild and this sign symptom like pyrexia, prostration, conjunctivitis, and erosive lesions in the mucosal oral mucosa. Then in case of this sheep and goats, I mean, this more or less similar, of course, as in case of this cattle, but signs are less precise than those in cattle. I mean, more severe lesions used to be there as in case of this cattle, but little bit milder it will be. Okay, and the fever may be at this variable, and there will be these anorexia conditions in those, and the diarrhea used to be inconsistent in case of sheep and goat. But whenever it occurs, of course, the signs, symptoms, and it is more or less similar to those, and this cattle, of course, may be milder. That's why when the animal population and the sheep and goats affected by this rinderpest in those days I am talking about, then about this disease PPR next. I mean, we are going to discuss about that PPR. So it was having much similarities. That's why it was very much difficult to differentiate these two diseases. So differential diagnosis was very much important in those days. Not now, because no occurrence of rinderpest, right? But who knows, if reoccurrence of this disease occurs again, you will face the trouble. I mean, for differential diagnosis, right? Then coming to PM findings, postmortem lesions. Starting from your amnis or your amnis esophagus, there may be brown and necrotic these lesions, and in the omesum means some erosive lesions may be there, but that is rare. It is not so common. But some hemorrhagic lesions used to develop. But when we are coming down to the intestines, the small intestine, abomasum, cecum, and neck, this colon and all, most commonly means they used to show necrotic and this severe congestion as well as hemorrhagic lesions. Okay, as I'm showing here, like I'm in the intestinal mucosa. So this kind of this thing, I mean here, I mean I also in the next slide, of course, in the linear form, I mean in lines type of this congestion or congestion or the hemorrhagic lesions. So that looks like a tiger stripes, or sometimes the stripes of the zebra. Okay, so that's why these are commonly known as zebra markings, looking like your tiger striping, or I mean these zebra markings. I'll show some more picture, very clear picture. Okay, so that zebra marking due to the linear hemorrhagic lesions or sometimes some congestion and all. So that used to be very much characteristic, and it was even this known as pathognomonic lesion of this disease rinderpest in those days, right? So I'll show the picture. I mean, last time I think some question was there on that, or what, I just forgot that. Then, as I have already mentioned, that in the clinical sign symptom means almost all the lymph nodes used to be affected. So all the lymph nodes used to be swollen and edematous and greatly enlarged, because this virus used to target the lymphoid organs. I mean, this lymph node, lymphoid organs, and the lymphoid tissues, right? Then sometimes the gallbladder may also be targeted and affected, showing hemorrhagic these lesions on the mucosal membrane or mucosa. And if lungs are affected, there means you may have the problem of emphysema, congestion, as well as some areas of this pneumonic changes, right? So now the picture what I'm showing down here, just see the linear hemorrhagic lesions with congestion and all cause this. It is giving like the stripes of a zebra. Okay, so these things are very much characteristic so far this lesion is and this disease is concerned. And of course, in case of PPR also you will find this type of these lesions. So these zebra markings are nothing but these are the linear hemorrhagic lesions on the intestinal mucosa. Okay, so that is very much important. And the what to say, this erosive and necrotic lesions on the oral mucosa, giving a bran-like deposit, as I have already shown also on in the earlier slide also. So these two things, if they are present, of course, additionally, I mean your gallbladder, then swelling and enlargement, the edematous condition of the lymph node and all, those are this additional, of course. I mean, of course, lymph node and this enlargement and swelling, edematous condition and all, that is also important, because the virus is having affinity to affect these lymph nodes and the lymphoid tissue, right? And these zebra markings and the brand-like deposits. And when we are talking about those, this intestine where the lymphoid tissue are there in the intestinal district, alimentary tract, those are known as pair patches, right? This, where the lymphoid tissue is aggregation of lymphoid organ, and this tissue is used, lymphoid tissue used to be there. So these parts being the, I mean, this virus having affinity or targeting the lymphoid organ tissue. So when they are affecting the intestines, so they used to mostly affect these pair patches, because these are mainly of this lymphoid tissue, right? That's why virus used to attack and this target this. And severe erosive, necrotic, and hemorrhagic necrotic lesions used to be developed here in such, I mean, this pair patches, right? These are some on this more photograph of hemorrhagic mesenteric lymph nodes, as I was talking about. Different lymph nodes and organs will be affected. and these are the pair patches showing hemorrhagic these lesions. And this is another, I'm just sloughing of the epithelium of on this part of the pair patches. Then ulcerative these lesions of the this mucosa of the upper colon. Then these are hyperemic changes. I mean, this as well as hemorrhagic lesions. Then I mean the one I was talking about this zebra markings due to hyperemia means congestion and the hemorrhagic linear hemorrhagic lesions. These are all, these different sources showing the zebra markings. And another thing is that in some cases where, this most means you can say most of the cases, the erosive and the necrotic lesions in this intestinal mucosa, intestinal tract. So when you open the intestine, mostly the necrotic tissue will be deposited on the intestinal mucosa, as I'm showing here. These are all necrotic these tissues, okay, depositing on this intestinal mucosa. So to see the pathological, gross changes on this intestinal mucosa, you should take it out this necrotic plaque or necrotic tissue first, necrotic material. Then only you will find like this, this linear hemorrhagic lesions showing the zebra markings or what kind of these other lesions and all these things. So these things are very much commonly happen, and these gross lesions you will come across. Okay. Then these are some more lesions. Already we have talked about the intestinal lesions and all, and gallbladder showing there's a hemorrhagic lesion on the mucosa. And Rinderpest in case of this wildlife means it is also have been this reported from this Africa. Then in the Kenya buffalo, okay, with diarrhea. These things, there are them this report shown that this wild buffalo means in this Africa, Kenya, where I'm just affected by this virus. Then some other this wild population and this known as kudu, one type of this deer like this animal, the wild ruminant known as kudu, and were also found and this to be affected by this virus. And in that case, enlargement and swelling of the this whole region, due to the enlargement of those lymph nodes in this area, it was found. And other than this enlargement of the lymph node and all this thing, it was also observed in some ocular lesion where corneal opacity, just like looking like a blind cornea, this used to be having this opaque lesion, this cloudy. Okay, it means leading to almost blind condition, blindness. Means that was also observed. These are like the this corneal opacity of the this kudu animal affected by this Rinderpest virus. These are all right. Then finally, this microscopic changes about this. So mostly we have learned that means erosive and necrotic lesions of the oral mucosa, mostly the whole intestinal tract, alimentary tract. So erosive lesions of this epithelium of the oral and the gastrointestinal tract will be there, and being an inflammatory reaction in such cases, and mostly the predominant inflammatory cells will be of mononuclear cells, that is lymphocytes. Okay, and there may be congestion and hemorrhagic lesions almost all the vessels in the intestines. And most commonly, most important thing is that being the virus is having, this targeting the lymph organ and tissue, destructing the lymphocytic cells. So you will observe in the sections of those, this lymph organ and tissues, and mostly like in case of this intestines, the part and this pair patches, if you make the section, see under the microscope, you will find almost all those lymphocyte cells. That means the lymphocytic cells are depleted, means destructed. Okay, so lymphocytolysis may also be in the lymph organs and lymph nodes like spleen and other lymph nodes. So if you make the section, see under the microscope, you'll find destruction, severe destruction, and this depletion of those lymphocytic cells, right? And finally, diagnosis. Clinically, it can be diagnosed because of the clinical signs and symptoms by this of the disease. Clinically, you can suspect that maybe this disease and all, but you should go for confirmation of this disease by isolation and identification of the virus by different bio and this laboratory and these techniques, many even the molecular techniques and all these things. Okay, but for sample collection and all this from the live animals, then from the dead animals, means what sample to be collected, as I have this just listed on this these things, means you just go through it. And so for the, I mean, differential diagnosis is concerned, so there are some diseases which are again having some similar signs and symptoms, maybe in the lesions with this Rinderpest. So that should be differentiated from this disease. So those are infectious bovine rhinotracheitis, in short IVR, bovine viral diarrhea, in short BVD, malignant catarrhal fever, MCF, FMD, means as we have already learned this. Then this blue tongue, salmonellosis, paratuberculosis, means Jones disease was, and that is another, and this bacterial disease of course. Then Pestidopetich ruminans, in short PPR, what we are going to discuss now. I'm just next. Okay, so these are the diseases which are important to be differentiated from this disease Rinderpest. In those days, not now, but who knows? I mean, if there is a reoccurrence of this disease, I mean, again, means we may have, I mean, this face, I mean, these difficulties for differential diagnosis of the disease from all these diseases, right? So now let me give some idea. I mean, as we have already discussed this Rinderpest, I will not take much time in the, I mean, your this. Can you see this? The slide. Hello.
Yes,
Hello.
sir.
You can see this, na? So this is about the disease Pestidopetich ruminans, commonly known as, in short, PPR. Okay. So which was, I mean, in those days, now of course means still it is going on, the occurrence is that it is prevalent in most of the parts of the world, but in those days, because of that disease Rinderpest, there was very much difficulties and difficult tasks for the researchers and academicians to give the differential diagnosis to differentiate from the Rinderpest. Not now, right? So this is a disease of the small ruminants. Okay, and the name itself, Pestidopetich ruminans, it is a French word, meaning is digestor's disease of the small ruminants. It is a very much similar disease caused by the similar, I mean, this virus, that morbillivirus. Okay, PPR, I mean, this Pestidopetich ruminant virus. Antigenically, it is more or less and the same as your, I mean, this Rinderpest virus. And here, one problem is that, as I have already mentioned, that these two diseases are very much similar. But one additional thing, I should say, I mean, this additional thing, but it is not additional that much. I mean, this additional or I'm this differentiated. I mean, this Rinderpest. When we talk about the Rinderpest, most commonly, the alimentary tract, that means the digestive tract, was severely affected. The affection of the respiratory system, it was there, but it was not severe. But in this case, along with this, your, I mean, this alimentary system, digestive tract and digestive system, severe affection of the lungs, I mean, the respiratory system also used to be there. That is little bit, I mean, this differentiating point from this. And one kind of this pneumonia, where you can find out some giant cells also in this case. Okay, so that's why that kind of this pneumonia, which used to be found and this observed in case of this PPR, is commonly known as giant cell pneumonia. Okay, so along with this, of course, I mean, that is by indicating that lungs is severely affected, and a more severe affection as compared to the this Rinderpest is to be here in case of PPR. Along with that, of course, the similarly in the erosive, I mean, this and necrotic lesions of the oral mucosa, as well as the, I mean, your intestinal tract and digestive tract used to be there. That is similar. And the zebra markings here also you will find. Okay. And here, one more thing is that when we are talking about the diarrhea, I mean, in case of this rinderpest and this, I mean, little bit, one problem means foul smelling direct feces used to be there, of course, right? Then there are so many synonyms of this disease. Those are pest of small ruminants, pest of sheep and goats, stomatitis pneumoenteritic complex or syndrome, pseudo rinderpest of small ruminants, because it is looking like and this rinderpest almost similar to rinderpest. That's why false rinderpest, pseudo rinderpest of small ruminants. Then kata and goat plague. I mean, because it affects mostly the goat population. Okay. I mean, as in case of this, I mean, your rinderpest, it was known as cattle plague. Similarly, it is, I mean, affecting the this goat population. So it is known as goat plague. And the last one, this contagious pustular stomatitis. These are the synonyms of this disease. These are important for your examination, sometimes for filling up the matching and all these things, right? Then species affected, as I have already mentioned, most commonly principal amylin affects the goat, but sometimes the sheep. Okay, and so far the wild ungulates are concerned. The cattle, pigs, I mean, it may be affected, but it is not that much. And the severe form, it will be there. It can be. I mean, then, I mean, when you collect the serum and this samples from the cattle and pig, it has been shown that the virus were present in those animals. That means they are affected, but they are not showing any severe signs and symptoms and all these things. So that is not much concern. But so far, the wild ungulates, I mean, some wild population of the small ruminants like gazelle, deer, ibex, and this James bog and all. So they were also found susceptibility to this, and this disease means they were also affected, right? Then the organism is more or less same as we have already discussed, morbillivirus of the family Paramyxoviridae, and much antigenically similar with those, I mean, the rinderpest virus and all. Then history, it means here, it means I will not take time here in the history. Please go through it. That is your part and the homework to go through it. Some history I have given, but rinderpest was much important here. I mean, the occurrence of disease, where from it started, first occurrence, then in India and all these things, right? So these things are there. Please go through it. Then this economic impact also, I will not take time. I mean, this what is economic importance already, I mean, I have given you the idea. Then geographical distribution, I will not take time, I'm skipping here. Then this morbidity and mortality also, I mean, more or less. But here so far, this PPR is concerned, the young animals are most commonly affected, those animals of the 2 months to 2 years of, and this all, and this animal goats, okay, or sometimes sheep. And I mean, the mortality, morbidity used to be varied according to the species of the animal, about the immune status of the animal, and even about the, I mean, the different breed of the animal. So it used to be variable. Okay, and the morbidity and mortality rates may be much high, even up to 10%. Here also, as in case of the NAP population. NAP population, those, I mean, with those animal population which have never been exposed to this disease. And when it used to be a little bit lower, I mean, lower in the endemic areas. That means where the disease is already going on, prevailing since few years, like, okay, endemic year, these areas. So they have been already exposed, those animals, and that's why, I mean, the mortality will be lesser. But the high case fatality used to be, I mean, this reported as in case of the, and this exotic ungulates, I mean, the exotic and this breeds, they used to be showing very high scale, this high case fatality whenever they are, this affected. Almost you can say 10% mortality used to be there. And transmission, I will not take, I mean, this of course, I mean, maybe mostly close contact and inhalation is the main and this source of this transmission, route of transmission. And the virus used to set in the this nasal and ocular secretions, sometimes through saliva, urine, and feces. And this long time carrier condition may not this happen mostly, means it is unlikely, means it doesn't happen much, and they carry this type of these animals after recovering from this animal this disease conditions. But role of these fomites, I mean, when the fomites are having any role for transmission of the disease, that is not much. I mean, having clear picture and that carry this support documents, that means the fomites are also, I mean, this having for taking the role for, I mean, this transmitting this disease. Okay, then this one also I'm just skipping appearance of the clinical form of the disease association. Then coming to the clinical signs and symptoms, as we have already discussed about the Rinderpest, more or less same. Incubation period means varies from 2 to 10 days, and it may be, I mean, this again, this we were divided into 4 clinical forms: or acute, subacute, and asymptomatic type of the, I mean, this PPR. Or acute, as we have already discussed, means sudden death of the animal will be there without showing clinical signs and symptoms. That used to be in case, any case of or acute, this form of the disease, of any disease. Then the most important one is the acute one, where acute form, where you may have high rise of this body temperature with serious nasal ocular discharges initially, then turns into mucopollutant later, and the gums used to be highly congested hyperemic condition with necrotic oral lesions, as means similarly as in case of your Rinderpest, as I am showing here, necrotic and the erosive and necrotic lesions on the oral mucosa, and a little bit your, I mean, this brown like deposit type also like here. And when they are going down there in the this digestive tract, intestinal tract, and all these things, so severe enteritis, okay, used to be there. So because of that, the animal used to show profuse, very severe form of this diarrhea, leading to dehydration and emaciation. After that, the animal will die of, I mean, this hypovolumetric shock, similarly as in case of this Rinderpest. Then when they are affecting the respiratory system, in that case, the animal will show very and this difficulties and much difficulties in the respiration, and then dyspnea, then rapid respiration. And if it occurs in case of this, I mean, pregnant animals, abortion used to be there. And sometimes in some cases, when you look at the, I mean, this muzzle area, okay, there means you may come across the, I mean, this formation of some nodular, hard nodular lesions on the skin just around this muzzle. Okay. Then subacute and asymptomatic. These are subacute in case of that mild form will be there. There is no any severe classical sign and symptom of this. And asymptomatic without any specific sign and symptom of this disease. Okay, means symptomless also, or you can say, but it doesn't mean that they are not affected or they are not containing this virus. They are containing, they are carrying the virus. They are and this having the virus in the circulation or in the body tissues and all, but they are not showing any sign and symptom of this very particular disease, PPR. So asymptomatic this PPR, right? Then these are these pictures showing the different clinical signs and symptoms. If you see here, these are showing this the nasal discharges, ocular discharges, and all like this. And I mean, in the this mouth and this muzzle area. Okay, this oral mucopollutant discharges also like. Then ulcerative and necrotic lesions on the oral mucosa, showing little bit black like brown like this deposits like this. Okay, so more or less similar as in case of your this Rinderpest. Here also see like this. Okay, ocular discharges turning into mucopollutant, right? Then showing with conjunctivitis, this reddened eye or conjunctivitis and all. Then diarrhea showing by the swelling of the this ear hairs just around the this anus and all these things, and the thigh, this thigh region and all these things. Then nodular lesions around the mouth and this muzzle area. Then coming to this PM findings and postmortem examination findings. So all those and this because membrane, oral cavity, GI tract, and all these things. So most commonly you will find the necrotic and the erosive and necrotic lesions the animal carcasses are very much weak and emaciated, dehydrated condition will be, and the necrotic and erosive lesions with linear form of these hemorrhagic lesions on the intestinal mucosa, and they will give the stripe, I mean this zebra like this striping, what we call zebra markings, similarly as in case of your this rinderpest. Then the another system, as I was talking about, little bit differentiating point from the rinderpest when it affects, of course, this very population, I mean this sheep and goat, for example. Then from this disease, PPR. That means in case of rinderpest, severe affection of the respiratory system doesn't happen. But here, in case of this very severe respiratory affection, respiratory system infection also used to be there, leading to bronchopneumonia, as I'm showing here. Okay. And enlargement and the swelling and this edematous lymph nodes and all that is also common as in case of this rinderpest similarly, right? But this affection of this respiratory system leading to severe this pneumonic changes, bronchopneumonia and all this thing. This is another this typical, or you can say specific feature of this disease PPR when you compare with the rinderpest, right? Similarly, means these are same pictures, I mean the enlarged one. Then in some cases, as we have learned in the systemic pathology in the respiratory system, adhesive type of this pleuritis. Okay, so this may also come across. That means pleura may also be affected within on this outer covering of the lungs. That the pleura also used to be affected, showing adhesive pleuritis like this. Okay. Then this is another picture of the lungs showing this pneumonia, severe pneumonic changes and all the different lobes, anterior lobes, cardiac lobes affected on this part of the lungs showing lesion. Then these are another this picture from different source. I mean showing the this lesion on the mouth cavity, then discharges from the oral and this or this nostril and your this eye, ocular discharges and all these things, and lesions on the intestine, then lungs lesions. This, and now I'd like to show this picture. So when you go for making section, particularly I'm talking about, others are more or less same, means as in the base, the this lymphocytolysis, depletion of lymphoid cells and all these things, and those are more or less same. But so far your lungs is concerned. When you see the lungs section, so there severe pneumonic changes, inflammatory reaction with the presence of multinucleated giant cells, okay, containing some intranuclear inclusions in those and these multinucleated giant cells. So those intranuclear in these inclusions take eosinophil, and this eosinophilic means they used to take the stand of eosinophils. So this is the most typical microscopic feature. Last time in the, this examination also it was there, I think, giant cell pneumonia, right? In the matching or somewhere, So that is nothing but the lungs affected by this virus, morbillivirus, causing this PPR and this disease. Okay, so that used to show the presence of these multinucleated giant cells with the presence of many these nuclei containing the eosinophilic intranuclear inclusion bodies. So this is very much pathognomonic, or means a characteristic microscopic feature of this disease, this PPR. That is one of the most important and this differentiating point. Others are more or less same. Of course, the virus, this isolation identification by molecular technique, that is also important. But so far, gross, then, and your microscopy, this examination. So you should have I'm just noting down this point. Okay. So this here another picture of that, and this lungs lesions, bronchointerstitial pneumonia. Okay, then thickening of the alveolar septa, interalveolar means in between the alveoli. Okay, that space, this tissue, interalveolar septa, that used to be very much thickened. Okay, then the presence of these multinucleated giant cells containing intranuclear eosinophilic inclusion bodies. and sometimes of course intracytoplasmic also maybe. Okay, both and the intranuclear as well as intracytoplasmic means within the nucleus, and the one is in the cytoplasm, not inside the this nucleus. So that type of this inclusion bodies also used to be showing under this, the multinucleated giant cells, right? And these are some picture and this collected from a case, of god, this died of your, this Rinderpest, showing the necrotic changes of the surface epithelium and very much extensive, this neutrophilic infiltration, very so many neutrophils, okay, in this area, with the presence of some, this syncytial cell formation, okay, shedding out of some type of the, the cells, okay, like this syncytial cells, and that used to show the presence of some intranuclear inclusion bodies also, right? Then this is another picture of this bronchial epithelium showing this epithelial cell degenerative changes. And finally, diagnosis. First, clinical diagnosis based on the clinical signs and symptoms. Then laboratory diagnosis for confirmation, for isolation, identification, and for this purpose, different techniques, for confirmation, for isolation, identification can be done. So antigen detection, you can go for then by using this RT-PCR for the detection of the viral genome of the this virus. By serological techniques, you can go for this demonstration and to demonstrate the presence of the antigen and antibody of this virus, and then means you can confirm this disease. And finally, here also differential diagnosis, of this disease can be done from many other this similar, just where you may have similar clinical signs and symptoms or the lesions. Those are Rinderpest, blue tongue, FMD, CCPP, contagious caprine pleuropneumonia. Full form is, okay, CCPP, contagious caprine pleuropneumonia. That is very much what having similarity some in the lungs lesion. Then pasteurellosis, contagious ecthyma, heart water, then coccidiosis, as and in case of mineral poisonings. Okay, so these are some of the points to be differentiated from the CCPP, means as in case of this, this CCPP, very severe fibrous type of this pneumonia used to be there, but that much will not be as in case of this PPR. And in case of this blue tongue and the bluish discoloration of this region, the coronary band of the hoop of those affected got, or sometimes in case of sheep also, like, so it will be there, but it will not be there in case of this PPR. These are some of the points, right? So that's all for today. And this way means I would like to take up the this systemic as well as these specific diseases in different classes, right? So that's all for today.